Hey there, I'm Bill Plant, and this is Washington Unplugged. President Obama's health care bill is struggling in Congress. In fact, today he's out having a town meeting in Virginia to try to gather support in places outside the Beltway. And at the same time, two organizations have launched multi-million-dollar campaigns to influence the new policy. And I'm joined today by Terry Tolasco, who is a spokesperson for Conservatives for Patients' Rights, which advocates for free market health care reform, and by Richard Kirsch, who is the manager of Healthcare for America Now, who supports universal coverage. Welcome to you both.
Thanks for having us.
Let's start this off by asking you both about the story in today's Wall Street Journal, which explains that the nation's largest employer, Walmart, has decided that it is for a mandate which would require employers to provide insurance. Now, what's your reaction to that,
Well,
Terry?
it's an interesting position for Walmart to take because it already gives most of its employees have health coverage or have ability for health coverage through their plan. So for them to decide that other employers should be mandated to have coverage is just sort of odd to me. I don't understand why they're going that way. They have in the past embraced policies that would increase coverage for people and lower costs for people without putting mandates on individuals or employers. So I have to say I was a little surprised to see this in the Journal this morning.
And Richard?
It's great that they're doing this. I mean, what they're saying is that every employer has a responsibility to either help provide coverage for their employees or to help pay for it. And the way we're going to make this a system that has good quality, affordable health care for everyone is through shared responsibility, making it affordable for individuals and they'll pay, make it more affordable for employers and they'll pay, and through government. And that shared responsibility is what we need so that everybody knows that at the end of the day they have good coverage that they can afford.
So part of the argument is built on a fear that a public plan, which the president advocates, would result in some sort of government takeover, and that's partly the theme of the commercials that your organization has been running.
Absolutely.
Let's take a quick look at one of those.
There are hundreds of choices in healthcare plans today, but imagine this is the massive government-run insurance plan some in Congress want. This government-run plan could crush all your other choices, driving them out of existence.
So Kerry, your argument then is that any kind of private plan would be a government plan, a public plan rather, would be a government plan that would drive the others out of business.
Absolutely.
But yet we don't know exactly what form a public plan would take.
Well, actually, that's more scary than anything else. Any government plan in any country around the world, including Canada and the UK, which are closest to us sort of culturally, has experienced rationing, withholding of care, unbelievably long waiting lists. Horror stories abound from those countries from people who can't get care. If the government is controlling the cost and the government is writing the check, then government is going to be very concerned about that amount of money that comes out. We have systems all over the world where there are mathematical computations made for patients in determining whether to give them our care or not. President Obama in the stimulus bill put through something called competitive effectiveness research, which is the baseline to set up a government-controlled plan. Without the information from patient outcomes, you can't dictate what treatments go through and what treatments do not.
Richard, the president's argument is that a public plan would serve as a counterweight to private insurance and force them to charge less to serve the market. What's your reaction? Absolutely.
And look, how many stories has your network run about private insurance companies delaying care, denying care? How many bake sales of people that had to hold the neighborhood because a private insurance company won't pay for care that someone needed to increase their profits? We right now don't have real choice because in 94% of the markets in this country, insurance is considered highly concentrated by antitrust standards. And Americans are experiencing premiums that are going up 3 or 4 times as much as wages. We need an American solution that fixes healthcare here. And one of the things about that is let's break this monopoly that private insurance has and the stranglehold in our lives and give people a choice. It should be up to individuals whether they want to choose a private insurance plan or a public insurance plan. That will, as the president say, lower costs and keep those insurance companies honest.
But what guards against a public plan, in effect, taking over?
Well, what I don't understand is how the insurance industry can even think that. They must realize how much people hate them. The insurance industry has right now 150 million people they cover. They have spent tens of billions of dollars on marketing. They have provider networks. They have contracts. If they think that having a new competitor from a public insurance plan is going to drive them out of business, they must think that they're doing such a lousy job that the public will be glad to get rid of them.
Well, on the contrary, I think they think, well, I'll let you speak to that. I think they think that it would, government mandate would drive down prices.
A couple of things. One, a government cannot be a competitor and a regulator at the same time. If government is indeed going to be in competition with private sector, how do we know that the regulations and the legislation that passed, it's obviously going to affect more positively the government side. You know, if Lance Armstrong wants to slow down and let the guy behind him catch up, that's exactly what's going to happen. We're seeing a lot of talk about individual mandates. That is going to drive people into a government plan. If there is competition, if you want to use that word, I don't agree with it, between government and private, if the government comes to an employer and says, I can cover your people for cheaper, would you like me to do that? They're going to bail out. As private employers bail out in covering people, that is going to drive up the cost of private care for the rest of the people who actually want the want the private care. And it's interesting to look at some of the polling numbers. There was a recent poll where 63% of people said they were in favor of a government plan, and 58% of those said that they didn't want it. So it's kind of a coverage for thee and not for me. There are reforms. We are very pro-reform at CPR. There are a lot of reforms that could go quickly that will decrease costs.
If you're concerned that the government plan would do those things, then why oppose employer mandates?
That is not the way to fix healthcare. You've got a number of people who are unemployed, uninsured in this country that have to be covered. There's no question about it. 31% of the uninsured are eligible already for Medicare, Medicaid, for other kinds of veterans benefits, and not looking up the system and employing those options for themselves. And you have a lot of people who are choosing, I call them NAFADODs, no apparent fear of death or disaster. Roughly 40% of people uninsured are just choosing not to, and they have the incomes that would support. So what we're suggesting is some changes. One of the big changes we could do is to allow individuals as well as employers to take a tax break for premiums, and allowing low-income people to have a refundable tax credit so that they can pay for their own insurance.
Okay, Richard, what would you propose to keep a public plan from taking over?
Well, again, the whole premise is wrong because, as I said, the private insurance industry has a lot of advantages. And where actually the proposals in Congress are talking about actually are a level playing field where the private plan and the public insurance plan have to play by the exact same rules and get the exact same support from individuals and taxpayers. There's no difference. But the thing about this debate, Bill, is it's not about just the uninsured. The fact is that people in this country can't afford the current private health insurance system. That's denying care, delaying care, bankrupting families. Literally, 3 out of 5 bankruptcies in this country, medical debt has part to do with them. And most of those people have insurance, but their insurance isn't good enough because it's high out-of-pocket costs. The insurance company won't pay something the family's got to. We need an American solution that makes sure that health care is affordable for everybody in this country and businesses. And we've seen what our current system gets, and rearranging the deck chairs in the Titanic, which is what Kerry's talking about doing, isn't going to do it.
Okay, very quickly, if there's an employer mandate, do you then really need a public plan as long as there's some kind of subsidy for the people who can't afford everything?
We're talking about 2 different things here. First of all, we need to be sure everybody has quality, affordable health insurance. Part of what employer responsibility is saying, right now all employers have to provide good coverage and they have to pay a significant part of that, which we don't have under our current law. So we want to be sure that happens. And then we need to get everybody in the system. And we're talking about, people are confusing the public insurance option from this whole question of how reform is going to work. Under reform, you'll get coverage at work, and we're going to be sure it's good coverage. But if you don't get coverage at work, you're going to go to a new marketplace where you can choose from private or public insurance, and your subsidy to make it affordable for you will go whichever you choose. It's your choice, private or public insurance. Okay. Kerry wants to deny you that choice.
We could go on like this for a long time, but Terry, I'm going to give you the last word.
Have you ever been to the DMV or called the IRS and asked them a simple question? We've all suffered the pangs of having to call an insurance company and pre-certify a test or a procedure of whatever kind. Can you imagine
So you're
being
saying
a
you
patient?
Can't trust the government?
No,
here.
you can't. Can you imagine being a patient and having to go to a bureaucrat and explain to that bureaucrat why you need a certain test or procedure? I think that's something that the American people, when they really think about it, absolutely do not want.
Well, thank you both very much. Congress is going to be grappling with this now over the summer. We'll see what happens. And in the meantime, thanks for watching Washington Unplugged. Join us tomorrow at 12:30 on CBSNews.com. I'm Bill Plant.